Today I'm going to discuss probably the most relevant subject to all cosmetic surgery users, and that is Botox. Now in this video I'm going to describe 10 key misconceptions about Botox treatment and what it can and can't do. So be sure to watch to the end because there are some real surprises in there. So if you've been to the channel before, then welcome back. If you're new to the channel, then welcome. Therapeutic Botox has been around since the 1970s when somebody distilled the active product from a rather nasty bug that causes gastroenteritis. In the 1990s, two brothers made a formulation that they thought they could use to paralyze muscle, and specifically used it to paralyze forehead frown muscles. And so the concept of therapeutic Botox for facial wrinkles was born. Now, since then, Botox has become a multi-billion-pound industry and is used by many people, male and female, of a number of different ages, both for beauty reasons, but also for other therapeutic indications. And it's become a very common tool in cosmetic surgery and in medical practice. Specifically today we're going to discuss how it is used in cosmetic treatment and describe some of the misconceptions about Botox and its use. Hopefully you will find some nuggets in this video that will help you make good choices about Botox use in the future. So number one, Botox is designed to make you look younger. This is sort of true. What Botox actually does, as many of you will know, is it paralyzes muscle. Now, when that muscle is problematic, and there's a number of places in the body where muscles being overactive cause us problems, then it can be highly effective. The key consideration when applying Botox to the face is to make wrinkles in the three main areas, namely the forehead, the scowl, and the crow's feet. By paralyzing these muscles, it makes these lines softer. No movement at all in these three areas is not a sign of youth. If you look at 18 or 20 or even 10-year-olds, when you look at their face move, they have movement, they have lines, they have wrinkles. And so when patients come to me and they say, I have had my Botox, but I can still move, could you put some more in? I invariably say, I can. But if a youthful natural appearance is what you're going for, then frozen is not a good look. Frozen is not natural. Frozen is not a sign of youth, but simply a sign that you've had Botox. Now, when Botox was new, this was the look that people were going for. It was almost a demonstration of, look, I've had my Botox done. But for me in my practice, and I think in the world at large, frozen, shiny faces with no movement in the three areas described are unnatural and a clear sign of someone having had Botox and trying to look youthful. There is a second issue that comes along with this, and that is what tends to happen is people in their 20s have Botox and people in their 50s have Botox, and if they all overdo it and get the frozen look, then they all look the same. So far from being a medication that makes you look more youthful, it just makes everybody from the age of 20 to 50 look a undefined age, which isn't really what most people are looking for, and it's certainly not what you would get if you came to see me in my practice. The next Botox myth that I really feel like I should discuss is one that people often bring to me saying, I've had Botox to my forehead, but what I really want it to do is lift my eyebrows. Now, I've heard this probably hundreds and hundreds of times over my Botox practice, and it is a fallacy that really needs addressing. The key areas for Botox, as we mentioned, are, amongst others, the forehead muscles. We call this muscle specifically the frontalis, which is the large forehead muscle that raises the eyebrow. Now, by raising the eyebrow, it causes transverse wrinkles across the forehead, which make us look old or tired. When we Botox this specific muscle, we paralyze it. Now, by paralyzing the muscle that raises the eyebrow, the inevitable effect is the eyebrows sit lower on the face. And not only do they sit lower, but they sit fixed in that low position. Now this is obviously quite a significant problem for people who have heavy low set eyebrows or equally heavy upper eyelids, because they tend to spend their day elevating their eyebrows to take both the weight from the eyebrow itself, but also to lift the upper eyelid skin, making them look less sleepy. When you have Botox to the forehead to try and minimize the forehead wrinkles, you will almost certainly get heavy eyebrows and heavy eyelids, and you will certainly get a worsening of your heavy brow and eyelids if you have them already. The number of times people have said, my forehead Botox lifted my eyebrows, is too many to mention. Now, for what it's worth, there is a way to lift eyebrows slightly with Botox, but it involves paralyzing the opposing muscle to the frontalis. Now this muscle is called the orbicularis, and it comes in 3 different circles. The outermost circle is the muscle that pulls the eyebrows down in a tight squint. When we paralyze a small section of the orbicularis muscle, specifically the section that sits underneath the part of the eyebrow we want to raise, then you can release the eyebrow up a little. It's a little bit difficult to know how much of an effect this will have, as the orbicularis is usually not the most dominant muscle in facial movement, but it will likely have a small to moderate effect on eyebrow position, especially if you're worried about your eyebrows becoming heavy or your eyelids looking heavy after Botox. This is not, however, Botox lifting your eyebrows as a matter of course. Injecting Botox underneath the eyebrow is a relatively specialist technique, as people are often anxious that it will give you ptosis. To say that Botox lifts the eyebrow, almost certainly when it's injected into the forehead, it's not true. Something that can help to elevate the eyebrow is to miss out the lateral corners of the forehead when injecting Botox. Now this can allow some relative elevation of the lateral brow, but it tends to give a inward slope, almost a Spock type look, which for me isn't a great natural look either, and is somewhat of a giveaway that you've had Botox. It also can leave individual wrinkles over the lateral corners of the forehead. The next misconception with Botox is somewhat of a follow-on from what we've just discussed, which is the number of patients who come back and say, I still have movement, can you put more Botox in? It follows on in all of life, but also in plastic surgery practice, that if some is good, then for many people more must be better. My classic rule of thumb for the perfect Botox administration is movement but no wrinkles. If you have movement of the forehead, even movement of the scowl, and a little bit of movement when you smile around the crow's feet, then this is a good Botox result. In some people with very fine skin, it's quite difficult to minimize the wrinkles while preserving some movement, because with fine skin, even a little movement tends to cause a few wrinkles. But the holy grail of Botox application is movement but no wrinkles. So when you have movement but no wrinkles, try not to go back to your Botox practitioner and ask for a little bit more, because your face still moves. That really is what we're aiming for. The next Botox myth I see and hear quite often is that if you do the same Botox application every time, you'll get exactly the same result. Now, I wish this were the case, because copy and paste from what we did last time is always by far the easiest way to apply somebody's Botox. But unfortunately, there are some external factors which influence any given Botox application. What we often see is the amount of physical activity in a single Botox therapeutic period can affect how long it lasts. The nature of the Botox, how long it's been out of the fridge, how well it's been kept, has a very significant effect. And so if the Botox practitioner you use is not keeping their Botox for the maximum amount of time of 2 weeks only, or if they're not keeping it in the fridge, then the effect will be diminished somewhat. Also, we see patients who have Botox injected in almost exactly the same areas have different effects due to the depth of injection, due to their muscle activity in the few days after. There are probably some factors associated with what you eat that affect how similar your Botox result is compared to last time. So unfortunately, even though we do our best, in my practice I always offer free top-ups within a few weeks after the primary application, because sadly it just isn't the same each time we do it. And so all we can do is keep accurate charts and try and make it as similar as possible. Is having Botox at an early age preventative of future wrinkles? Well, this is an interesting one because in some ways it sort of is, but of course this would assume that facial movement is the only predisposing factor to facial aging. Now, of course, I have a busy facial plastic surgery practice where if Botox was the only thing that people needed to make them look youthful into older age, then that would be all that I did, and it isn't. So in terms of Botox as a preventative, then simply speaking, the way I describe it, if you take a pair of jeans or a piece of paper and you repeatedly fold it in exactly the same place, week after week, month after month, then eventually you will form a crease or a fold which is quite difficult to remove. Now, what Botox does for people in their late 20s and early 30s is it prevents these creases from forming, and therefore, if you don't make the creases in the first place, they're less likely to become deep set and ingrained. Having said that, the difficulty is that as you age, due to external factors like your skin type, your genetics, sun exposure, pollutant exposure, your skin will get thinner as you get older. Now, as your skin gets thinner, it becomes more easy to crease and more wrinkles will form. Once you have these wrinkles, then yes, Botox will minimize them, but the effects of facial aging become not just about the movement, but then they become about skin quality, and ultimately they become about a number of other factors, including skin elasticity, skin thickness, skull changes, fatty compartment changes. And so Botox will only improve the movement and crease forming element of this dynamic, and therefore is not the only answer to future facial aging. I often have patients with subtle asymmetries asking me whether Botox is the answer to all of their problems. As you can imagine, some asymmetries can be improved by Botox, but the vast majority cannot. Most asymmetries of muscle are either static or dynamic. What I mean by this is that some asymmetries are noticeable when the patient's muscles are not active. For example, eyebrow asymmetry. Your eyebrows may be asymmetrical at rest, but symmetrical when they move, or conversely, they may be symmetrical at rest and then asymmetrical when they move. Now, as you can imagine, Botoxing one of these states will likely improve the symmetry at that position, but unfortunately it will probably exacerbate the asymmetry in the alternative state. Types of asymmetry which can be helped are other types of muscle asymmetry like smile, eyebrow position, facial asymmetries sometimes associated with things like Bell's palsy. Types of asymmetry which clearly cannot be helped by Botox are fundamental structural asymmetries, either made up from previous injury, previous scars, bony skeleton asymmetries, which are actually very, very common. In some people, the left and right side of their face just aren't ever going to be the same. For these people, Botox will have a limited role in improvement, but it certainly will not make people fundamentally symmetric. And so it's important to understand and accept this. The next myth that I would like to dispel is that bruising is a failure of Botox application. I've had a number of patients suggest that they have developed a bruise after their Botox and that is somebody's fault. Unfortunately, part of the advantage of working on faces for a living is the fact that the blood supply is so rich. Now, this is great when it comes to healing, but it's rather unfortunate when it comes to bruising and swelling. In patients with moderately thick skin, it's impossible to see the small arteries and the small veins. If we go near to one of these or puncture it, then you will get a bruise. In an ideal world, we would like to see these bruises minimized to no bigger than a fingernail. And for the ladies, they can usually cover these up by the time they become brown or yellow, which may take between 2 to 4 days. But unfortunately, bruises are an inevitable byproduct of having something injected into your face with a sharp needle. So if you have something in your busy social calendar which doesn't allow you to put up with any bruises, then please manage your Botox appointments appropriately so that you don't coincide the two. The only sure way to avoid bruises with Botox is to not have any Botox. Something else I'd very much like to discuss is Botox ptosis. Now, ptosis is a result of a weakness of muscle that inserts into its leading edge, and as that muscle slowly contracts, the eyelid slowly raises. In some rare, in my experience, circumstances, a tiny bit of Botox can migrate from the point of application onto this little tiny muscle. Now, it needs a very, very small amount of Botox for this to become a problem because the muscle is so weak. If this muscle is paralyzed by Botox, then that eyelid on that side will not open fully, and we call this Botox ptosis. Ptosis can be seen in a number of patients for other reasons, but if it comes shortly after a Botox application, then in all likelihood it's the Botox that's the cause. If you have ptosis, then please don't be angry with your practitioner. It is a well understood and well recognized complication of Botox application. In my experience, it isn't localized to one specific Botox area, although the only times I've ever seen it is Botox above the eyebrow, not below the eyebrow. I personally believe that if the Botox gets underneath the forehead muscle and potentially even underneath the periosteum, which is the lining of the bone, then it can find its way down the front of the skull into the eye socket and onto the eyelid elevating muscle, causing ptosis. I have seen ptosis in a few of my patients, and interestingly, on 2 occasions I've seen the same patient get ptosis more than once, indicating that some people are prone to it and some people are very unlikely to have this problem, which to me suggests an anatomical quirk in certain people. If you develop ptosis, then it looks a little strange. The good news is there is some eye drops which can improve the appearance of ptosis in the short to medium term. These eye drops are called iopidine, and what they do is they stimulate a whole new garage door elevating muscle system, which is not quite as reactive to lift the eyelid up, but can mask the effects of a lazy eyelid opening muscle. You can put these eye drops in 4 to 6 times a day, and unfortunately all else you can do is wait for the Botox to wear off on the affected muscle and the eyelid will start moving again. It always does. I've seen ptosis arising from Botox last several weeks, and without the eye drops it can be quite obvious. The next myth is based around numbing cream. Now, some practitioners, and for your information I don't do this, will apply certain topical local anesthetics based on lidocaine or similar. These come in cream formulations. It's suggested that adding cream to the face before Botox or even filler injections will make a difference to the discomfort. Now, in my experience, the numbing cream needs to be applied extremely liberally and at least an hour before the injection. And even having said that, the Botox needle itself is still a little uncomfortable when it penetrates the skin, because the only level that is anesthetized by the cream is the very superficial layers. Some people have tried blowing cold air across the face before applying Botox, but doing the application quickly, as atraumatically as possible, and with confidence is probably as much as you can do to minimize the discomfort from Botox. Many patients don't have an hour to wait around while their numbing cream works, and certainly there is no guarantee that the numbing cream will make it pain-free, and in fact, in my opinion, it is still likely to be moderately painful, despite the fact that Botox needles are extremely fine. The best thing that we can do as Botox practitioners is make the whole experience as quick and effective as possible. Something else that's worth discussing is that Botox application is easy. Now, there has been some regulation in the UK and elsewhere in the world which now controls who can inject Botox. It needs to be prescribed by a medical practitioner, but there seems to be a number of practitioners who find their way around these rules, and certainly in my experience Botox is being injected by a very broad range of practitioners. Ultimately, is Botox easy to inject? Well, yes it is. With a little bit of practice you can get the dosing more or less right, and you can get the injection points from any website, and so physically putting Botox in somebody's face is relatively easy. The key to good Botox application, however, is to not look like you've had a heavy dose of Botox recently. Good Botox is a natural look which conveys a youthful appearance but doesn't look artificial or frozen or shiny, and this is where both experience, anatomical understanding, an appreciation of skin quality, skin thickness, sun damage, patient age, what looks natural for a given patient versus a copy and paste type approach to all Botox patients. This is where the nuance and the artistry of Botox practice comes into play, and it is this specific level of skill and understanding which is not easy to come by. If you are having Botox and you want it to look good and look natural and last a reasonable amount of time, then it's for these reasons that you should seek an experienced practitioner rather than somebody who has read how to do it only recently. Another common Botox myth is that from an aesthetics point of view, Botox can be used in a number of other areas rather than the 3 traditional areas we've discussed. Now, to some degree this is true, but mostly this is again false. Other areas I've seen Botox used is in the lips, in the nasolabial lines, in the chin crease, in the buddy lines either side of the nose, and in the neck. Now, it's also used in many other medical applications, which we're not going to discuss today. But from an aesthetics point of view, Botox in the lips is a terrible idea in most cases. The lip is a very delicate, coordinated muscle. Actually, it's made up of a number of different muscles with a very delicate, very accurate circular muscle in the middle, which allows us to talk and whisper and whistle and not dribble our coffee. If you put Botox anywhere near this extremely accurate, delicate muscle, then we tend to lose the ability to do all of those things, which is far from ideal. Now, in a small number of cases where the smile may be asymmetric or excessively gummy, or in patients who have a fundamental mouth shape asymmetry, either due to stroke or palsy or some other medical complaint, then trying to balance out that asymmetry with a little bit of Botox can be effective. But broadly speaking, from an aesthetic point of view, Botox around the mouth is a terrible idea. Botox in the chin crease can be effective, and so this is one you may consider. Botox to stringy neck lines can also be effective, but you need very large doses across the entire neck, and so is unlikely to make a significant change unless it's done by someone who is expert in face and neck surgery. Botox in the eyelids or in the fine lines under the eyes is also a terrible idea, and Botox to any area of the jawline or of the cheeks is also very unlikely to give you an improvement. What we often find is people who have Botox to sell will find additional reasons to sell Botox to you, and so be aware if you're considering Botox out of the 3 traditional areas. Another Botox myth that we hear quite often is patients asking whether it's appropriate for them to either sit bolt upright or sleep with extra pillows, and also whether they should move their face to prevent the Botox migrating, and the facial movements are aimed to maximize the onset of the Botox. It's certainly not necessary to sit upright. There is plenty of evidence that strongly supports the fact that Botox does not migrate from the injection site. Having said that, in the example of ptosis, where the Botox can find a backdoor route from one anatomical space to another, then this is possible, but in my experience the Botox does not migrate, and therefore sitting in an unusual position bolt upright almost certainly makes no difference. There is some evidence to suggest that moving your face after Botox application will make a difference to the onset, but it doesn't make any difference to the duration of the Botox effect, and it's quite difficult to convince people to move their face repeatedly. It's probably worth mentioning here that Botox is not licensed for pregnant or breastfeeding ladies. Now, the evidence that Botox doesn't migrate to any tissues, including the breast or the milk or the developing fetus, is very strong, but it would be impossible to get ethics approval to base a study on the aesthetic benefits of Botox in a group of relatively vulnerable individuals, and so our advice to anyone breastfeeding or pregnant is that they shouldn't receive Botox because there is no evidence that proves that it's safe in this group of people. Overall, the good news about Botox administration is it's extremely effective, it's very, very safe. It does pretty much what it says on the tin in the vast majority of cases, giving an impression of youth, even though it doesn't necessarily make us youthful. And when done expertly, it's typically not noticeable. I always say that good plastic surgery walks past you in the street. You don't stop and stare, or you don't notice good plastic surgery. And that for me is the key to good Botox application, as well as good facelift surgery or good plastic surgery in general. If you have any Botox questions or any other questions about cosmetic surgery, facial or otherwise, then please get in touch with me at adamgoodwinsurgery.com. The contact details are available at the end of the video. Also, if you liked the content of this video or would like to see some more, then please like, subscribe, and have a look at my YouTube channel, Adam Goodwin Surgery, where there are a number of other topics covered which you may find of interest.